The fluorescent lights hummed overhead, a sound like electricity trapped in glass. Danielle Ross moved through the corridors of St. Michael's ICU with the efficiency of someone who had learned long ago that wasted motion was a luxury she could not afford. It was 11:41 p.m., the start of another night shift, and the ward was a landscape of monitors and machines, each beep a conversation she understood without translation. The smell of antiseptic hung beneath something else, something organic and true, the scent of bodies fighting to stay alive. She pushed through the double doors to Bay 4, where her station waited. Charts. Medication logs. The continuous low percussion of alarms that never quite stopped. 3 other nurses were at the central desk, younger than her by a decade at least, and they scattered slightly when she arrived. Not from fear. From the simple acknowledgement that she was the one who caught what others missed. The one who noticed when a patient's breathing pattern changed 2 beats too slow. The one residents consulted before they consulted the attending. Night, Danielle, offered Marcus, a second-year RN with kind eyes. Mrs. Patterson's for is infiltrating again. And the colonel in 412 just came up from trauma about an hour ago. Shrapnel wounds, Helm and Province. They're saying his Air Force, some kind of officer. He's stable but... She was already moving. But what? Restless. Won't sleep. Asked for his vitals 3 times in the last 40 minutes. Keeps staring at the ceiling like he's waiting for something to happen. Danielle nodded and pulled his chart. The admission notes were sparse: multiple penetrating injuries from IED fragmentation, left anterior thigh laceration with extensive soft tissue damage, right shoulder wound approximately 3 centimeters lateral to the acromion process. The handwriting belonged to a trauma surgeon who knew how to document and nothing more. She scanned the physician orders, pain management, wound care, nothing unusual. But there was something in the vital signs pattern that made her pause. Heart rate trending up. Blood pressure stable but climbing. The vital signs of someone in pain, yes, but also in anticipation. She had not served 9 years as a combat medic embedded with the 455th Expeditionary Medical Group without learning to read the difference. Bay 412 was at the end of the corridor, separated from the others by a curtain that had seen better days. She pushed through it with her hands carrying fresh gloves and saline, letting the sound of her badge lanyard announce her arrival before her body did. The man in the bed was built like someone who had carried weight, literal and otherwise, through terrain that tried to kill him. His left leg was elevated on a pillow, the surgical dressing pristine white. His right shoulder was wrapped. But his eyes were the first thing she noticed, and they moved to her face with the precision of someone trained to assess threats in half a second. His pupils dilated. Slowly. Then a deeper dilation as recognition moved across his features like a storm front. "Captain," he said. Just that. Just her rank. Just her military rank, spoken in a room where everyone thought her first name was Danielle and her competence was a quirk of temperament. She did not hesitate. She did not freeze. The trembling wasn't fear. It was the shock of a life compartment bleeding into another. She set the saline down with the kind of careful precision that made the movement seem routine, when everything inside her had shifted like tectonic plates. "Colonel," she said quietly. "How's your pain level?" His eyes held hers for another second, a second that contained conversations and decisions and the weight of memory, and then he looked away. "I'll manage. Like always." She checked his vitals with hands that moved through the motions they had performed 10,000 times. BP 134/88. Heart rate 96. Oxygen saturation 98 on 2 liters. The numbers were good. The man was not. She had served alongside him in Sanjin Valley, had watched him strip a buddy's body armor after a firefight to assess for shrapnel injuries, had seen him work with the kind of calm that only came from accepting his own mortality long before he got shot. Colonel David Mercer had replaced her on the medical line when she rotated home with a thigh wound that had healed wrong. 3 weeks after she left, an IED hit their patrol. He had pulled shrapnel from his own shoulder and kept working. Just like that. "I'm going to help you rest," she said, keeping her voice level. Let me get you something for the pain and we'll talk about the wound care in the morning when the attending's on shift. I know what I need, he said, but it was not defiance. It was statement. It was the voice of someone who had learned to accept help only when it came from people he trusted. And he was looking at her like she was a person he could trust. She pushed for milligrams of morphine through his foreline, watching it enter the tubing like fog dispersing. She adjusted his pillows, checked his bandages, confirmed his fluid intake, did all the things a night nurse did when she was trying not to acknowledge that her entire reason for being in Atlanta had just become flesh and blood in front of her. The job at St. Michael's had been specific. 6 months undercover, embedded as a nurse, there because someone had compromised their unit's location in Helmand province. Someone had leaked the grid coordinates to the Taliban. Someone had gotten 6 soldiers killed in a patrol ambush that should never have happened. The leak had come from the hospital network, communications recorded in the shadow of this facility, or so the Pentagon's cybersecurity team had determined. And Danielle, with her medical credentials and her clearance, had been placed here to identify who among the staff had turned, who among the doctors or administrators or visitors had sold their grid coordinates for money or ideology or whatever calculus led a person to betray soldiers. Colonel Mercer had been the reason she had come to Atlanta. Colonel Mercer did not know he was the reason. He thought he was here for shrapnel wounds. He thought she was a night nurse named Danielle Ross who made his run smooth. She was back at the desk when Dr. Pierce arrived for grand rounds. He moved through the unit like a man who owned it, tailored white coat, stethoscope draped across his shoulders in a way that looked casual but was precisely calibrated to catch light. He was the kind of man who had never learned to doubt himself because doubt required the ability to see yourself from outside your own perspective, and he simply did not possess that capacity. Morning rounds, he announced to the collective staff. Let's start with Bay 8. Danielle continued documenting. Mrs. Patterson's infiltrated 4. New access established at 11:52 p.m. Patient tolerance good. She recorded it all in precise notation. 12 hours of monitoring. 12 hours of competence rendered invisible because it was part of the machinery, not the machinery itself. Ms. Ross. Pierce's voice. She looked up. He was holding a chart. Her chart. From 3 days ago, the documentation from the Jacobson patient, a 67-year-old man admitted with pneumonia who had deteriorated rapidly until Danielle had noticed his oxygen saturation dropping despite normal ventilator settings. She had flagged a tension pneumothorax before he coded. The chest X-ray had confirmed it. Pierce had signed the order for the needle decompression she had already identified the need for, taken the credit in his documentation, and moved on. He was holding that chart in front of 20 medical students and residents who had gathered for rounds. The fluorescent lights caught the paper. The room went quiet in the way rooms went quiet when something important was about to happen. This, Pierce said, tapping the page with his pen, is an example of what we call scope creep. Dangerous scope creep. A nurse making clinical assessments that belong to physicians. Look at this notation here, tension pneumothorax suspected. Recommend immediate CXR and possible needle decompression. Recommend. Possible. A nurse using diagnostic language. Practicing medicine without a license. The students looked down. Looked at their shoes. Looked anywhere but at Danielle. She did not look away. She did not blush. She did not lower her eyes in shame at the public humiliation. She simply listened, with a kind of cold flat stare that belonged to someone who had listened to far worse than this in far more dangerous circumstances. The controlled anger was ice. It was the temperature of a night sky above Helmand province. It was the temperature of someone who understood that responses given in the moment often became evidence later, and patience was sometimes the most powerful move available. It's concerning, Pierce continued, warming to the audience of younger doctors, that we allow nurses to develop such inflated impressions of their competence. It leads to dangerous overstepping. It leads to patients being harmed by people with delusions of relevance beyond their training. Danielle finished her documentation. She did not stand. She did not defend herself. She simply looked at him with eyes that had assessed casualty wounds and made triage decisions that meant the difference between someone going home to their family or being flown out in a flag-draped case. The students felt the weight of that stare. Even Pierce paused for a moment, something flickering across his expression, not quite fear, but an acknowledgement that he had just said something dangerous to someone he did not understand. Then he turned back to his students and kept talking. The colonel had sent her here to do a job. Identify the leak. Find the source of the compromise. She had taken a nursing position because it gave her access to personnel files, email traffic, meeting minutes, communication logs. She had been listening to the hospital network traffic for 6 months, and she still had not found definitive evidence. But Colonel Mercer lying in bay for 12 meant she was running out of time. He meant the Pentagon was activating protocols. He meant someone wanted answers now. The vending machine hummed its mechanical drone at 2:13 a.m., fluorescent light casting everything in that peculiar hospital white that made skin look cadaverous. Danielle fed a dollar bill into the slot and pressed for black coffee, nothing else at this hour, nothing that required her to linger. The night shift stretched ahead like a runway with no landing lights, and she'd learned long ago that invisibility required minimal footprint. Dr. Pierce rounded the corner with an intern trailing behind him, some third year who'd been shadowing all week. The intern looked exhausted, the particular kind of exhausted that came from absorbing contempt through osmosis. Ross thinks she's playing doctor because no Real hospital would take her, Pierce said, loud enough to carry down the corridor. Not to her. Loud enough for her to hear him pretend she wasn't there. His voice had that particular texture of someone who'd rehearsed an insult in private, perfected it, waited for an audience. She's got what I call nursing delusion syndrome. Reads 3 journal articles and suddenly she's got an MD written in invisible ink. The intern shifted his weight, uncomfortable in that way young doctors got when they recognized cruelty but hadn't yet developed the spine to name it. Danielle's hand remained steady on the coffee cup. The plastic was still warm. Everything in a hospital was always still warm. What she doesn't understand, Pierce continued, gesturing toward the hallway with his other hand, is that there's a reason protocols exist. There's a reason nurses don't make decisions. The liability alone, he shook his head like he was performing sadness for an audience that wasn't there. It's actually dangerous to patients when someone lacks the proper training. Danielle turned to leave. The coffee cup made no sound in her grip. You see that? Pierce called after her, his voice cutting through the antiseptic air like a scalpel through muscle. That's exactly what I mean. No defense. Because deep down she knows I'm right. She kept walking. Her breathing remained steady, in through the nose for 4 counts, hold for 4 counts, out for 4 counts. Combat breathing. The kind you learned when your heartbeat mattered more than your dignity. The kind that kept you alive in places where showing anger meant showing weakness, and weakness got people killed. The next evening found her in Trauma Bay 3, running a code blue on a patient who'd coded during a routine dressing change. The resident had frozen, literally frozen in that deer-in-headlights way that happened to good doctors in their first real crisis. The patient's oxygen saturation was dropping like a stone, 92 to 88 to 82, and nobody was moving except Danielle, whose hands were already reaching for supplies before her conscious mind had caught up with her instincts. She identified it in seconds, the unilateral absence of breath sounds, the hypertension, the sudden collapse. Tension pneumothorax. Air was building in the pleural space, compressing the lung and collapsing the mediastinum. The room went dead silent. The kind of silence that came when you dropped a truth so precise and surgical that there was no clean recovery from it. The resident's eyes went wide. One of the nurses actually inhaled sharply, that small involuntary sound of witnessing something irretrievable. Pierce's face went through several colors. Red. Darker red. The color of someone realizing that his hierarchy had just collapsed on the monitor itself. Danielle turned away from him while he was still searching for words that would never come. She checked the catheter placement one more time, ensured the patient was stabilized, and walked out of the bay without a single backward glance. The other nurses parted for her like she was cutting through water. What she didn't know was that her cold precision had just made things infinitely worse. Over the next 72 hours, Pierce did what competent antagonists do. He didn't yell louder. He didn't confront her again. Instead, he activated his network with the kind of methodical focus that came from someone protecting his professional survival. He called in favors from 3 board members who owed him, physicians he'd trained, administrators whose children had benefited from his referrals, hospital leadership who depended on his reputation for excellence to reflect back on them. He contacted Danielle's nursing school references with pointed questions about her stability. Whether she'd ever demonstrated signs of boundary issues. Whether anyone had ever expressed concerns about her judgment. The questions were perfectly phrased to sound neutral while painting her as mentally unstable. Insinuation was far more effective than accusation. He brought in an outside consultant from a hospital quality assurance firm to investigate her pattern of dangerous overstepping. Not just the code blue. He went further back. He pulled her chart notes from 6 months of shifts, combed through them for anything that could be weaponized, anything that suggested she was operating outside her scope of practice. In the ICU, residents and staff who'd previously asked her opinion about clinical decisions suddenly stopped. The shift supervisor stopped giving her preferred assignments. Other nurses who'd sought her guidance suddenly found reasons to consult the attending instead, not because of competence, but because the wind had shifted. Because power was relocating. By the 3rd night, Danielle understood what was happening. This wasn't about the code blue anymore. This wasn't about a single moment of overreach. Pierce was dismantling her credibility systematically, using institutional leverage to isolate her, making her increasingly toxic to be around. She'd seen this before. It was what you did when someone had your number and you couldn't afford to let them keep talking. You didn't silence them. You made them unreliable. You made everyone else question their judgment until standing next to them felt like a liability. The fluorescent lights buzzed overhead, and Danielle understood that her mission was becoming compromised. The colonel was stable, recovering. Her presence here had become a liability to him, not an asset. She checked the faded unit patch sewn inside her jacket lining one more time, fingers tracing the edges of fabric that had survived Helm and Province, and understood that something far worse than a firing was about to happen. The routine dressing change at 14:22 started like any other afternoon on the ICU ward. Colonel Mercer dozed in the bed, his left shoulder wrapped in fresh gauze, the shrapnel wound from Helm and Province finally showing signs of healing after 3 weeks of careful monitoring. Danielle moved through the steps with the muscle memory of someone who had done this exact procedure 1,000 times before, peeling back the old dressing, assessing the wound bed, checking for signs of infection that never came because she checked it obsessively, every shift, every 4 hours like clockwork. The fluorescent panels overhead cast their pale glow across the monitors tracking his vitals. Oxygen saturation 97%. Heart rate 74. Blood pressure 118/81. Everything normal. Everything stable. She had just smoothed the new sterile dressing across the wound site when the colonel's eyes snapped open and he gasped. Not a small sound. Not a groan. A gasp that came from somewhere deep in his chest, the kind of involuntary sound a body makes when something fundamental shifts inside it. His right hand flew to his ribs, fingers clawing at the sheets, and his eyes went wide. Danielle's own eyes narrowed immediately because she had seen this before. She had seen it in the dust outside forward operating base Shank when a Marine took shrapnel to the chest cavity. She had seen it in the back of a Black Hawk during dust-off when a soldier's lung started collapsing from a hidden pneumothorax that nobody caught until it was almost too late. Her hands moved before her brain finished processing the data. She was already reaching for the blood pressure cuff even as the monitors began their frantic beeping, the oxygen saturation dropping 98, 94, 89. The numbers falling like stones down a well. Help, the colonel gasped. Can't breathe. Something's. I know. Her voice had already changed. Not the deferential nurse voice that Dr. Pierce despised, the one she wore like a uniform around the hospital. This voice was different. Lower. Controlled. The voice of someone who had issued commands in the thunder of incoming fire. She reached across him and placed her hand on his right chest wall, fingers spread across the second and third ribs, and felt what the monitors were already screaming. The trachea had deviated slightly toward the left. His breathing was shallow, panicked. His skin was already turning grey at the edges. The dressing change had somehow introduced air into the pleural space, maybe a nick from the shrapnel, maybe a rib fracture that had finally given way. The mechanism didn't matter. What mattered was that his lung was collapsing and he had maybe 90 seconds before his heart rate would start dropping instead of climbing, and that drop would mean the end. Tension pneumothorax, she said, not to him, to herself, the diagnosis crystallizing in her mind with the precision of a laser. Right side. Tracheal deviation. Accessory muscle use. She was already moving to the crash cart, her hands flying across the surface, and she did not call for Dr. Pierce. She did not wait for the attending physician. The senior resident was probably in the cafeteria. The intern was definitely in the cafeteria. The only hands that could fix this in the next 60 seconds were hers, and she knew it the way she knew how to breathe. The 14-gauge angiocatheter needle was exactly where it should be, 3 inches from the top of the crash cart in the plastic package that had been designed for exactly this emergency. She tore it open with her teeth, a gesture that would have horrified Dr. Pierce if he had been present, and moved back to the bed with the needle gleaming under the harsh lights. The colonel's eyes were losing focus now, his oxygen saturation at 76, dropping, and his heart rate climbing to 142, 151, the body fighting for survival with everything it had left. She palpated his ribs, fingers finding the anatomical landmarks she could navigate in the dark if she had to, which she had, once, in a phi base near Lashkar Gah with nothing but moonlight and the sound of mortars falling 2 clicks away. Second intercostal space. Midclavicular line. She swabbed the skin with antiseptic in a motion that took 2 seconds, and pressed the needle in at a 45-degree angle. The resistance came first, the needle sliding through skin, through muscle, then the hiss. A sound like the earth exhaling. Air rushing out of a space where it should never have been. The sound of pressure releasing. The sound of a lung re-inflating. The monitors caught it a half-second later, oxygen saturation climbing, 68, 72, 79, 85, 88, 92, stable at 94 and climbing still. The colonel's body went rigid for 1 more second and then went slack, his breathing deepening, his hand releasing its death grip on the bedsheet. His trachea shifted back into alignment as if the body itself was sighing with relief. Dr. Pierce arrived exactly 30 seconds later, pushing through the ICU doors with the confident stride of someone who expected to find a patient in crisis and himself as the hero of the story. What he found instead was Danielle standing beside the colonel's bed with her hand on his chest, the oxygen saturation reading 94%, the heart rate normal, the breathing steady. What he found was his narrative shattered. What he found was a nurse who had just performed a procedure that was supposed to be his exclusive domain, and his face went the color of old pennies. "What did you do?" His voice came out as a whisper, which somehow made it worse. "What the hell did you do?" "My job." Her eyes were cold as north wind over water. Tension pneumothorax. Right side. He was losing consciousness. "You weren't here." Pierce's hands were shaking. Actually shaking. She could see the tremor in them as he stepped forward and checked the needle placement, the catheter cap, the positioning. Everything was exactly right. Everything was perfect. The procedure textbooks would not have done it better. His junior residents would not have done it better. And it had been done by someone he had spent 6 weeks systematically destroying. "You had no authority to." His oxygen saturation was 68, Danielle said, and her voice cut through his protest like a knife through silk. "You were in the cafeteria. I was holding a patient. Choose which part you'd like to prosecute." She removed her hand from his chest, checked the catheter seal one final time, and stepped back. "His vitals are stable. I'd recommend a chest X-ray to confirm lung re-expansion and rule out additional injuries from the dressing change. The pneumothorax may require observation or chest tube placement depending on the imaging." Pierce stared at her. His jaw worked like it was trying to form words that wouldn't come. Around them, the nurses and the one medical student who had been within earshot had gone completely still. The monitor's gentle beeping filled the silence like the only honest voice in the room. "I'm calling the board," Pierce finally said. "I'm calling them right now. You performed a procedure you're not licensed to perform. You touched a patient without physician authorization. This ends today." Danielle turned back to the colonel, who was watching her with eyes that suddenly seemed to see straight through the scrubs and the badge and the identity she was wearing. She adjusted his oxygen, checked his made a note in his chart. Her hands were steady. Her breathing was steady. The ice in her blood had not even cracked. But what he had just witnessed in that procedure, the precision and the knowledge and the absolute command in her voice, that was going to matter. That was going to matter far more than either of them knew. Dr. Pierce didn't wait for the monitors to stabilize. He didn't wait for Danielle's hands to step back from the needle. He was already moving toward the door, already reaching for his phone, already composing the narrative in his head that would bury her. The sinus rhythm humming from the cardiac monitor meant nothing to him. What mattered was what he had just witnessed, a nurse performing a procedure that belonged exclusively to physicians, and doing it with the kind of precision that made his own hands feel like they'd been tied behind his back for the last 15 years. He made the first call from the hallway. "Board of Nursing, Disciplinary Division. I need to report a serious protocol violation. A nursing staff member performed a needle decompression on a critical patient without physician authorization. That's practicing medicine without a license. Felony territory, actually." His voice carried the confidence of a man who'd never been told no by an institution. By 2:15 p.m., he was sitting in a conference room with 3 board members. 2 of them owed him. He'd helped expedite their medical licenses 8 years ago when regulatory paperwork had stalled. He'd written a letter of recommendation for the third one's daughter to Johns Hopkins. They leaned back in their chairs and listened while he described Danielle's pattern of boundary violations, how she'd been consistently overstepping, how residents listened to her instead of attending physicians, how she possessed delusions of medical competence. He didn't mention that she'd saved a man's life. That detail didn't fit the narrative he was constructing. By evening, Pierce had placed 3 more calls. One to his old attending from Emory, who'd taken a position at the Joint Commission. One to Danielle's nursing school in Pennsylvania, with pointed questions about her stability and judgment during education. One to a healthcare compliance consultant based in Charlotte, a man who specialized in building cases against problem employees. "I need someone who can document a pattern," Pierce said quietly into his phone. "Not just one incident. A pattern that shows poor judgment, boundary issues, maybe some anger management concerns. You understand what I'm saying?" The consultant understood perfectly. That's what he was paid for, taking one moment and weaving it into a tapestry of documented problems. Danielle stood at her locker at the end of her shift, still wearing the same scrubs, still wearing the same cold flat expression she'd worn when Pierce burst into the trauma bay 30 seconds too late. She pulled out her personal items methodically. A cracked mug with "World's Okayest Nurse" printed on it. A dying succulent in a ceramic pot. A photograph of her Phi-base team, 12 faces, most of them smiling into a camera with Helm and Provence dust coating every surface. She was placing these items into a cardboard box when the security officer found her. "Ms. Ross, I need you to come with me." Not a request. It was a command delivered with the kind of politeness that made it clear resistance would only complicate things. They escorted her through the staff corridors at 10:48 p.m., when most of the day's shift had cleared out. A few night nurses watched from the distance. One of them had worked with Danielle for 3 years. Even she didn't know what to think anymore. The consultant's preliminary report had circulated through email, vague language about concerning patterns and judgment lapses and the potential safety risks. Danielle's name had appeared in 3 separate incident reports over the past 48 hours, each one describing behaviors she'd never committed, each one written in that bureaucratic tone that made lies sound like documentation. At the security desk, they handed her a termination letter. 1 page. Standard template. The language was clinical and absolute, violation of scope of practice, practicing medicine without a license, patient safety concerns, immediate effective date. She didn't argue. She didn't ask for a hearing. She just took the box and nodded once. "Your badge," the security officer said. She pulled it from her pocket and set it on the desk. The laminated photo showed someone in scrubs with neutral expression. Not her cover. Her actual face, living her actual life in a hospital that had never known who she really was. The rain started the moment she stepped outside. She was sitting at the bus stop bench on Piedmont Avenue when the water found her. Not a light rain, sheets of it, the kind that hammered against the pavement and bounced 3 inches back up. Her scrubs clung to her skin. Her hair dripped in a straight line down her spine. She set the cardboard box beside her on the bench and stared at it like it contained the evidence of her entire civilian existence. Inside, a cracked mug. A dying succulent. A photograph. The photograph was from Phi Base Yazdan, June 2019. 12 soldiers standing in front of a Humvee. Danielle had her arm around Martinez, who was grinning at something someone had said. Behind them was Corporal Sarah Chen, who'd been killed 2 months later when an IED detonated under her convoy. Behind her was Lieutenant Jackson, who'd taken his own life 6 months after redeployment. The back row held for more names. For more families who'd received flags folded into perfect triangles. She picked up the photograph and held it in the rain. The drops beaded on the laminate and rolled off the edges. She thought about dropping it into the gutter and walking away. About washing her hands of the whole thing, the mission, the cover, the people she was supposed to protect. The bus shelter's plastic walls rattled in the wind. She was the only person waiting. No one else in Atlanta sat in the rain at 11:23 p.m. staring at a dead plant and a $10 mug. She thought about the colonel. About how his eyes had closed the moment her needle released the pressure. About how his oxygen saturation had climbed from 72 to 89 to 96 while his body finally got the air it needed. About how it took her exactly 42 seconds to save his life, and 48 hours for Pierce to destroy hers. The mug had been a gift from the SARC training program at Fort Liberty. Survival, evasion, resistance, escape. The unit motto had been painted on the bottom, leave no one behind. She'd left the colonel in that ICU. Her cover was blown. Her mission was finished. The leak that had killed half her team was still alive somewhere inside that hospital, still breathing, still moving through those corridors, and she was sitting on a bus stop bench at the edge of Atlanta with a dying plant and a cracked mug. The wind picked up. One of those gusts that turned umbrellas inside out and made you wonder why you'd bothered leaving the house. She heard something else underneath it though, a low mechanical sound cutting through the rain from the south. Not a siren. Something deeper. Something rhythmic. She closed her eyes. Helicopter rotors had a specific signature. UH-60M Black Hawks from Hartsfield-Jackson maintained a pattern of 4.4 cycles per second. That's what was coming through the rain now. That's what was making the air itself vibrate like a tuning fork. She opened her eyes and looked back towards St. Michael's, 3 miles northeast. The rain was too heavy. She couldn't see the rotor lights yet. But she could hear them getting closer, and she could hear something else underneath the rain now, radio static, clear and sharp and military encoded. The ground was vibrating. Not from the bus stop. From the sky. 3 days later, the emergency transfer rolled through St. Michael's doors at 11:51 p.m., and the trauma team scattered like startled birds. A Taliban commander, 53 years old, 2 years into medical asylum, his leg mangled by IED fragmentation patterns that Danielle would recognize in her sleep. They wheeled him past the ICU, past the colonel's room, down to Trauma Bay 3 where the fluorescent lights buzzed like angry insects and the smell of diesel and scorched flesh preceded him by 10 seconds. Danielle was checking vitals on the patient 3 doors down when she heard it, a voice rising in the hall, cracked and urgent and familiar in a way that made her hands stop moving. She stepped into the corridor and saw him, the commander, his head turning toward the neighboring bay where a nurse was adjusting an IV. His eyes went wide. His body went rigid. And then he started shouting in Pashto and broken English, screaming the same word over and over. The White Angel of Helmand, she's here, the White Angel is here. Her cover exploded like a breech charge. Every nurse in the unit turned. Every monitor seemed to scream louder. Danielle didn't move. Didn't flinch. Just turned back to her patient and continued checking the pulse oximeter reading as if a ghost from her past hadn't just shattered 18 months of carefully constructed anonymity. The commander kept screaming. Hospital security was already moving toward him, hands raised, voices low and steady. But the damage was done. The name, the call sign, was already out of his mouth, traveling through the unit like shrapnel, embedding itself in the ears of nurses who suddenly understood they'd been working beside someone from somewhere else entirely. The colonel's call button lit up. Then again. Again. His monitor showed his heart rate climbing from 82 to 104 to 118, adrenaline flooding his system from 2 rooms over. Danielle heard his frantic voice on the intercom requesting the charge nurse, requesting a doctor, requesting someone immediately. She was moving before she consciously decided to move, muscle memory taking over, 12 years of response patterns overriding 18 months of restraint. She was inside his room in 4 seconds, closing the door behind her. He was sitting up despite the post-operative restrictions, his face flushed, his breathing shallow. That's his voice cracked. That's Captain Nightingale, sir. In the unit. That's her. That's Danielle. Each word came out like a prayer. Like an oath. His hands were shaking. His eyes searched her face the way men search for their brothers after battle, desperate and terrified and relieved all at once. Breathe, Colonel. Her voice had changed. The timid nurse was gone. The surgical precision had returned. Deep breaths. In through your nose. Your heart rate is responding to adrenaline, not medical crisis. You're stable. But they don't know who you are, he said. They fired you. They. I know. She placed her hand on his shoulder, and it was a gesture she'd made 100 times before, in fire-base tents, in medevac helicopters, over wounded men who couldn't move. Stay calm. Don't move. Let your incisions set. The chief of surgery arrived at the door 60 seconds later, followed by nursing staff, followed by the growing chaos of a hospital discovering something it didn't understand. Dr. Pierce was somewhere in the building. Danielle could feel it like pressure before a storm. The chief of surgery was asking questions, pointing at monitors, directing traffic with the authority of someone who'd managed trauma for 23 years. And the colonel was whispering to him, just loud enough for Danielle to hear, "That is my medic, sir. She outranks everyone in this building." The chief turned. His eyes moved from the colonel to Danielle and back again, and she watched his expression shift from confusion to calculation to a kind of profound respect that required no words. It was the Marine Corps liaison who arrived next, crisp uniform, covered glass eyes, the kind of calm that came from having personally informed families of losses. He was holding a file, and when he saw Danielle, his posture straightened in a way that made every nurse in the unit pause. He opened the citation with military precision, his voice modulated and clear. For extraordinary heroism under fire, Captain Danielle Ross, call sign Nightingale, performed 127 combat medical evacuations under enemy contact, providing emergency life-saving care in active combat zones. He paused. 2 silver stars. Bronze star with Valor. 2 purple hearts. The room stopped breathing. Dr. Pierce burst through the door like he'd been shot out of a cannon. His face was red, actually crimson, the color of rage that had nowhere left to hide. "This is absurd," he snarled, his voice cracking with fury. "She's a nurse. A junior staff nurse who assaulted my patient and then faked a medical emergency." A 2-star general walked in. Not entered. Walked. The way generals move through spaces that suddenly become smaller because they're in them. She wore her decorations like a language, and her eyes went straight to Danielle's jacket, the one hanging on the back of the door, the one she'd kept in her locker for 18 months. Her hand reached out, slow and deliberate, and she touched the faded patch sewn inside the lining. The 455th Expeditionary Medical Group. Danielle's unit. Her command. The general saluted. Actually brought her hand up and saluted, palm forward, the way soldiers salute their own. The room understood everything at that moment. Security was removing Dr. Pierce before he could finish his second sentence, his voice climbing higher and more desperate with each word, his hands flailing like he could somehow punch his way back into reality. The chief of surgery had stepped back. The nurses had moved away from Danielle like she'd suddenly become a different species. The colonel was crying, silent tears rolling down his face, because finally, someone was seeing what he'd known all along. The general turned to Pierce. Your facility accommodated a commissioned officer in breach of military code. You terminated her based on a false report. Her voice was shaped like a blade wrapped in politeness. You're fired, doctor. Your license will be reviewed by the state board. Federal investigators will be here in the morning. What happened next ended careers. The video hit social media before midnight, 15 seconds of Pierce at the vending machine, his voice loud and contemptuous, mocking a decorated combat veteran to an intern. By 3:22 a.m., it had 70,000 shares. By dawn, it had gone viral, tagged by nursing advocates, shared by military support groups, embedded in think pieces about institutional abuse of power. His medical school mentor, a legendary trauma surgeon named Dr. David Holloway, the kind of name that carried weight in medical circles, saw the video at breakfast. He picked up his phone. He made 3 calls to St. Michael's board members. By noon, a formal statement had been released disowning Pierce and demanding an immediate fitness review of his medical license. The Federal Bureau of Investigation arrived at 2:06 p.m. on a Wednesday. They came with credentials and questions and the kind of institutional authority that made hospital administrators suddenly cooperative. They interviewed staff. They reviewed communications. They traced Pierce's phone calls to the 3 board members he'd contacted, then to the consultant he'd hired, then to his reference calls about Danielle that had all been documented. Each one was a thread. Each thread led to others. By Friday morning, Dr. Pierce had been formally suspended from practice pending investigation. By the following Monday, his license was under formal review. 6 months later, Danielle stood in St. Michael's new veteran care unit, a 12-bed wing dedicated to military personnel and former combat medics, and she was wearing a nameplate that read Captain Danielle Ross, Director of Veteran Services. The hospital had added her position in the wake of the scandal, along with a comprehensive anti-retaliation policy and mandatory training for all senior physicians on respecting nursing expertise. The colonel came for his follow-up appointments every 6 weeks, and each time he did, Danielle would stand at the window of her office, touching the faded patch that hung in a frame on her wall, remembering the soldiers who'd never made it home, the medic who'd replaced her. The ones who should have had second chances but didn't. Somewhere in Tucson, Arizona, a man named Stephen Pierce was driving a medical supply van between rural clinics, his name tag reading just Steve, no doctor attached anymore. When people called him doctor, his entire body would flinch. He never smiled. He never looked anyone in the eye. The medical community that had been his entire identity was closed to him now, and he understood finally that competence without character was just privilege that eventually devoured itself. Danielle had a choice: accept a promotion to chief of trauma, the title they offered, the power they promised. Instead, she asked for something else, a rotation back into direct patient care. Some days she was in the ICU. Some days she was in the emergency department. Always, she was in scrubs, her hands doing the work that had defined her long before anyone knew her name. The patients never called her captain. The residents asked for her opinion without her asking for theirs. The nurses understood something they couldn't quite articulate, that the quietest person in the room, the one checking vitals without comment, the one who'd survived things that would break most people, was holding it all together. The trembling wasn't fear. It was restraint. It had taken 18 months to learn how to be just a nurse again. It took 6 months more to understand that being just a nurse, with her hands and her knowledge and her impossible calm, was exactly as much as anyone needed to be. On a Tuesday afternoon in November, the Colonel sat in her office while she reviewed his latest imaging, and he finally said the words he'd been carrying: "Thank you for coming back. For being here. For not walking away when they fired you." She didn't look up from the scans. "I never left," she said. "I was just waiting for the right moment to be seen." The room went quiet. Scars tell stories. Some of them speak in silence. Some of them wait years for anyone brave enough to listen. If you're enjoying the story so far, hit that like button. And I'd love to know, drop a comment telling us where you're watching from.